Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to take your calls for the entire hour. So let's go to the news now. Let's see what's happening in the health world so we can get as many calls as possible. Traumatic brain injury and concussions both increase the risk of early death. Researchers from Oxford evaluated over 218,000 traumatic brain injury patients and 150,000 siblings of traumatic brain injury patients. They used over 2 million healthy subjects as controls. Traumatic brain injury is defined as a blow to the head that leads to skull fracture, internal bleeding, and loss of consciousness lasting for longer than 1 hour, or a combination of these symptoms. Concussion or mild traumatic brain injury is defined as a blow to the head that results in the temporary loss of brain function. Loss of consciousness may or may not occur with concussion. The study found those who sustained traumatic brain injury were 3 times more likely to die before the age of 56 than the controls. They also found those who sustained a concussion were twice as likely to die before 56. Suicide and accidental deaths were the most common cause of death for both groups. This is a real eye-opener, folks. This study was published in the Journal of the American Medical Association Psychiatry, and it was performed by Oxford researchers. As I read this study, the very first group of people I thought of was young athletes playing in contact sports such as football and hockey. It is common for these athletes to receive head trauma and concussions. It is not so common for them to lose consciousness for over an hour, but it is common for them to receive multiple relatively minor head blows that can most certainly add up to major brain damage. After all, head trauma is like radiation. Little doses add up to big doses over time. And over time, those who play football, hockey, soccer, boxing, and other contact sports receive multiple minor head blows that can lead to devastating brain damage. All of us who have an interest in sports are aware of this increasingly common problem. The report states standard medical practices today do not account for assessment of mental health or suicide risk in traumatic brain injury patients. Based on this study, they strongly urge physicians, patients, and family members of traumatic brain injury patients to be aware of this suicide possibility. We should also monitor patients for depression and signs of substance abuse, which often precede suicides in these unfortunate souls. It is also obvious to this reporter that protective headgear needs to improve, as does the way these sports are played. Would it really change the game of soccer that much if players were prohibited from striking the ball with their heads? Or football, if they were prohibited from head-to-head contact? I don't think so. Seniors who garden or do home maintenance jobs receive the same health benefits that formal exercise provides, finds research reported in the British Journal of Sports Medicine. Researchers followed almost 4,000 seniors for over 12 years. They evaluated a wide array of lab values and lifestyle practices. They found the seniors who regularly did odd jobs around the home, gardened, or exercised formally were about 30% less likely to have a heart attack or stroke, and they were 30% less likely to die from any cause. Related research reported in the journal Circulation finds senior heart patients benefit from personalized preventive care. The team of researchers report that seniors receive the greatest health benefits when they are included in their planning for their strategies for disease prevention. The researchers report that plans to help control obesity, high blood pressure, diabetes, cholesterol, physical inactivity, and tobacco use are still beneficial to seniors even if they are 80 years old or more. When we view these two studies together, we see that if seniors do not like to go to the gym and work out with a trainer, formal exercise plan, if this is not your cup of tea, it's all right because you can receive the benefits of exercise by just doing odd jobs around the home or by gardening. That's one of my favorite activities. Folks, I agree with these studies completely except for one thing, and that is their recommendation for seniors to focus on lowering their cholesterol level. The Nurses' Health Study has followed some 120,000 women for many years now. They found that the following risk factors lead to heart disease, and elevated cholesterol was not one of them. Those risk factors are smoking, excessive alcohol use, carrying too much weight, little or no exercise, and eating too much sugar. No mention of cholesterol at all. It's sugar that we must limit, not cholesterol. I am reminded yet again of my Aunt Lucille. She lived to be 92, and she did it while having a cholesterol level of over 500 her entire life. But Aunt Lucille loved to take walks and work in her garden. She ate as healthfully as anyone I've ever met, and she loved Jesus. Now that's a recipe for a long, healthy life. Today on Your Health, we will be taking your calls for the entire hour. Stay tuned. We'll be right back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net. I'm Cindy Becker for Your Health at a Glance. Are you looking for a healthy replacement for sodas? For thousands of years, the Far East has enjoyed the many health benefits of green tea. Now the Western world has embraced this potent antioxidant for its many health benefits as both a drink and supplement. Green tea has been thoroughly researched. It's been shown to improve bone density and immunity, as well as levels of cholesterol, blood sugar, and blood pressure. Research has also shown it to decrease inflammation and one's risk of cardiovascular disease and many forms of cancer. One recent study even found that people who drink 5 or more cups a day were 33% less likely to develop conditions that cause disability. For health, it is everyone's cup of tea. For Your Health at a Glance, I'm Cindy Becker.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today.
We're back, everyone. We are just so blessed to be with you today, and we hope that everything is going wonderful for you, whatever you are doing. I'm so glad you tuned in today because you know what? Today is all about you. We're going to be able to take calls the entire hour today. We want to see if we can talk to as many people as possible. So be sure you pick up that phone, dial 800-635-2673. Well, let's get right to it, shall we? Let's go to Indiana and welcome Deneen to the show. Hi there, Deneen.
Hi, how are you?
Oh, we're
Great.
doing great. How are you today?
I'm doing fine, thank you.
Good. What's on your mind, Deneen?
Well, about 8 years ago, I developed breast cancer. I had stage 2B and went through chemo, radiation, and the whole thing.
Yes.
And everything was well, and I went into a remission, and then approximately about 3 months ago, I started having fatigue and was having shortness of breath and found out that I was having fluid build up in my lungs.
Okay.
Well, through a series of tests and removing the fluid, it was discovered that the breast cancer came back.
Right.
And it was determined it was in the lining of my lungs. Had a CT scan and discovered there were a couple spots in my liver as well.
Okay.
So in October, I had surgery. They took the cancer out of the lining of the lungs, and currently I'm in going through treatments right now, chemo treatments with Taxol. And so...
Are you responding to these treatments? Can you tell yet?
Yes. I've not had any fluid in my lungs, I mean, as far as I can tell.
Okay.
I'm gaining strength. The chemo, I'm actually going to have my 6th treatment in a couple days.
Okay.
And I changed my diet when talking to a doctor of natural health. And I'm gaining strength each day and feeling good, but I just want to make sure it doesn't come back again.
Yeah, absolutely. Deneen, I have a question for you. Did it surprise you that the cancer was back, or were you expecting it?
Absolutely, it surprised me.
Okay.
I thought I was done with it. It'd been 8 years. I was on tamoxifen for 5 years, and then went on letrozole for 3, and was totally surprised when it came back.
Okay. Did you spend any time thinking, and I'm sure you did, about the reasons why this cancer has come upon you?
Oh, definitely.
Have you addressed those issues?
Yes. I mean, I've changed my diet. We've gone to all organic now.
Good. That's very important.
And we have been reading your book and others like, treating cancer with nutrition.
Right.
So, I want to start taking supplements and start, rebuilding my body back to full function.
Deneen, what kind of work have you done?
As far as job responsibility?
Yes, your professional life. What's your exposure? I'm getting at your exposure.
Oh, I'm in the office. I'm a financial analyst, so
Okay.
I'm in a corporate environment.
Okay. So this means, Deneen, your vitamin D level is tragically low, doesn't it?
Okay.
It does mean that, doesn't it?
Yes, I think before I started going to this, within the last month, I've increased my vitamin D level to, I've been taking like 6,000 IUs a day.
Good.
So,
Very good. And
okay.
It would be wise for you to determine your vitamin D dose by your blood levels. For most people who don't have cancer, I recommend around a 50 nanograms per deciliter, a level of vitamin D, but for you it needs to be 70 to 80. I want you to get it up higher. We have multiple studies now that show breast cancer outcomes are dramatically better when we're taking higher levels of vitamin D. It's like 60% more likely to live 5 years. Now, you're 8 years out with a recurrence. Also, I want you to be totally aware that when breast cancer comes back, and this is true for all the carcinomas, essentially all the carcinomas, when it comes back, it's harder to fight it. Right? Have they told you that?
No, they have. But
well, I believe patients need to know the truth. We're not gaining anything by misleading patients, not telling them what they're up against. Humans need to know the truth. It's how we create resolve and commitment to treatment, when we know the truth. If you don't know the truth, how are you going to make changes? Doesn't that make sense to you, Deneen?
Absolutely.
It does. So all I'm saying is you're going to have to really pay close attention to everything this time around, because the statistics suggest you won't have a third chance. I don't want to scare you, but it's the truth. So we have to do everything as best as we can, and God will make up the difference. We do the best we can, right?
Right.
So you mentioned beating cancer with nutrition. I'm so glad you're reading that. You have a copy of that, correct?
I do, yes.
Yes, read it thoroughly. Take notes while you're reading it. Also, Foundations for Healing. There's one you don't have. It's Dr. Blaylock's Cancer Strategies. That's the one. I want you to read that because he goes into great detail about the powerful antioxidants that can help you. So I want to send you that book. I want to send you Noni. Are you in pain, dear? Are you having trouble with pain?
No, not too much. I mean...
Okay. Well, studies suggest and conclude that cancer patients have a better quality of life with Noni. It helps with pain. It helps activate the immune system, and this is really our quest, is to improve your immune response. I want to send you vitamin D because I want you to have plenty of it. Vitamin D is one of our cheapest supplements, and it is absolutely the most powerful. So it's really a hormone. It's the cancer hormone, and you need to take advantage of it. Take whatever it takes to get your blood level up to 70, 75, somewhere in there. Next is curcumin. This powerful antioxidant, it has remarkable anti-cancer properties. The medicinal mushrooms and beta-glucans, they contain beta-glucans, these medicinal mushrooms. They activate the immune system, and when it activates the innate and the adaptive, meaning it helps you fight cancer, cellular recognition, that's the innate, and it also helps you fight one of the most common complications of cancer, that is an infection, such as yeast troubles. Cancer therapies suppress your immune system. That's just how they are. And this leaves you susceptible to yeast and parasites, which will further diminish your ability to fight. The medicinal mushrooms help to counter that. They are very important natural agents for the cancer patient. Good multiple vitamin and mineral. There's been a series of studies that showed when you use supernutrition in cancer patients, their life expectancy increases from 800 to 1,200%. And this is just eating a high-quality diet, organic, which is absent of pesticides and contaminants, and a good high vitamin dose. I want to send you a good multiple vitamin and mineral powder. Grapeseed extract with resveratrol. We need to support your mitochondria, those part of your cells that give energy to your entire body. It fails in cancer treatment, and you can end up with great complications. So CoQ10 and L-carnitine is very helpful. I would recommend doing something to help get heavy metals, plastics, toxins out of our system. You're doing the diet, but a little alpha-lipoic acid and maybe cracked chlorella. But go real slow and easy on the cracked chlorella, because as we pull these toxins out of your body, it can make you feel bad. And I don't want to overwhelm you with that. So we use maybe just one a day or a half a capsule a day to get started and slowly advance that. Follow your diet and consider one last thing before the break. I want to get this in. There are recorded cases of breast cancer going into remission simply from taking higher levels of iodine. So I want to send you a bottle of Iodoral. Read about it, learn about it. It doesn't happen in every case, but keep that in mind. If times are tough and we're not making progress, consider adding a little iodine to your supplement plan, and I'm going to send you a bottle so that is easy for you to do. Deneen, hang in there. You're in our thoughts and prayers. We have a break. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bionovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828. That's 888-442-1828. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone. Let's go to Arizona now and welcome Jeff to the show. Hi, Jeff.
Hello,
Hi, Doc.
Jeff.
How are you guys doing today?
We're doing pretty good. How's life in Arizona?
It's just beautiful weather, you know. But other than that, as far as my personal health condition, it could be better. I'm hoping this phone call will, which I really appreciate you guys taking my call. I appreciate your program, but I hope this phone call will help some.
Well, we're going to do our best. What's on your mind, Jeff? What's the problem?
Well,
How can we help?
Well, this has been going on approximately about 2.5 years or so. I was initially on heartburn medication. I probably pronounced it incorrectly, the Polizol.
Yes?
Started having some stomach issues. Went and had an endoscopy done. A couple polyps in my stomach. Those were removed. Everything else was clear. Esophagus, stomach, no cancer, no anything. Everything was really, really good. So the doctor at the time at the endoscopy told me to start taking more heartburn medication.
Yes.
Which didn't make any sense to me because I wasn't having that much heartburn.
Right.
So as time went by, I ended up having a prostate issue, which I took antibiotics for. Then I had a UTI issue, which I took more antibiotics for. And now I think I'm to the point where I've gotten into I think it's to the point where it's at leaky gut syndrome.
Right, right. It makes total sense. You know, the PPIs, proton pump inhibitors, the strong acid-suppressing medicines, they cause a dysbiotic state. Your bowel flora becomes altered. It also decreases your ability to absorb B12 because acid breaks apart protein. B12 is embedded in the proteins, and you have to break it apart to release the B12 so you can absorb it. And when you're low in acid, you're just not doing that very well. It also decreases your magnesium absorption, and so that is enough to create a cascade of bad health. And to make matters worse, about half the people respond to proton pump inhibitors and even the H2 antagonist. Anything that is a strong acid suppressor, you get a rebound effect when you try to stop. In other words, they're dependency forming. You get started on them, they're hard to stop. So you imagine this scenario where you've suffered with, let's just say, heartburn or even a stomach ulcer. You take these medicines and you feel better while you're on them. You say, well, it's time to stop. And even though your stomach scenario is healed and you're fine, when you stop the medicine, it feels like you have too much acid and the ulcer's back. Oh, man, I got to stay on these medicines forever. And so this leads to nutrient deficiencies and altered bowel flora. And don't ever forget, folks, if there's one thing you remember from this program and all 1,500 of them that we've made, 70–80% of your immune system's in your gut. When your bowel flora is off, you've opened the door to every disease known to humanity. And you can't fix these diseases until the bowel is corrected. And it sounds, Jeff, like you're right in the middle of this. Now, one of the things that perpetuates leaky gut syndrome, one is yeast. That's the obvious one. But what about immune reactions to foods? Have your doctors checked you for celiac disease? Have you ever thought, Jeff, you know, I eat this food and it makes me feel terrible. I wonder if I'm reacting to my foods. Have you ever thought that?
I've had the series of tests that I have done since the endoscopy. I've had an ultrasound done. I've had 2 CAT scans done, a gastroemptying test, stool test, blood test that included gluten and food allergies. All came back negative.
All came back negative. No parasites, none of it. What about heavy metals? Have you been checked for that?
No, sir.
Heavy metals can, you know, here's the danger of heavy metals. If this is a complicated subject, I'll do my best to make it understandable by all. If you go to the archives and try to determine how many Americans die every year from heavy metal poisoning, it's around 5,000. That's a very small minority. But what happens commonly is people get toxic levels of heavy metals. It suppresses mitochondrial function, it suppresses your immune system, and it opens the door to all these problems. And it mimics our most common diseases. So it can make it look like you have irritable bowel. It can make you look like gluten sensitivity. It can make it look like you have heart disease or arthritis or depression, all these things. And of course the doctors focus on the obvious, and they're not checking heavy metals because only 5,000 people a year die from heavy metal poisoning, so it can't be that. You follow me? And you, please believe me, folks, this is how we suppress our body's ability to fight off. Normally, a healthy adult human being can just fight off disease. It's amazing what a healthy body can do. But when you are low in vitamin D, when your bowel flora is off, and you have a mercury level in your bloodstream that creates a state of toxicity, you can't. And you're in a constant state, just like you are now, Jeff. What do you think of those statements? Am I a quack, or am I hitting the essence of your problem? You tell me.
I think you're hitting the essence of the problem, but to be honest with you, Doc, I mean, this got so bad because of my lack of knowledge and taking the heartburn medication. I got off the heartburn medication, and you're 100% right. The first 3 days were horrific.
Yes.
But after I got past those 3 days, of course, I was still feeling kind of rough, and then I had all my work stress and all the stresses that were involved, and I think it actually got to the leaky gut portion of it, and then I started finding out.
I get you, Jeff. Now, you said you had food allergy testing done, correct?
Yes, sir.
Did you have food sensitivity testing done? Food allergy is the IgE antibody. It's the same antibody that creates the reaction to peanuts in kids, that causes ragweed allergy and sniffles, asthma, and about half asthma sufferers. But only 5% of the United States population has that kind of food allergy. Your type of food sensitivity is 40%. 40%, and MDs don't even check for it. That's what you have, brother. You can find out on your own by doing an elimination diet, or you can send a blood sample to Cirex Labs in Arizona. It's in Arizona, my goodness. It's in Arizona, Cirex Labs. Go on the internet, find it. The first step is just elimination diet. Go on the internet, understand what elimination diet is. Please, Jeff, pay attention to these words. It'll make a huge difference in your life. I want to send you some things to help you along your way. I want to send you some things. I want to send you Foundations for Healing. You may have, Jeff, did you say you already have that book? No?
No, sir, I don't. I've got one from Dr. Colbert down in Florida that I'm reading through right now.
Okay, when you're done with that book, read this one, because the entire book is you. What I did with this book was I gave you examples of some 20 different health conditions, our most common health conditions that are caused by dysbiosis. And you're in that group, and leaky gut is part of that. So it's important for you to read this book and follow the recommendations. Every single thing is important. Elimination diet, or antibody panel to foods, including IgG antibodies. Write that down. This is important. Probiotics, and I mean a lot of probiotics. Every meal should have yogurt, cottage cheese, buttermilk, kefir, whatever you like. I'd rotate around, and every meal should have a probiotic tablet supplement. I want good bacteria all over your gut. Just overwhelm the bad guys. Next, oil of oregano. Oh, the energy of oil of oregano. It's the single best anti-yeast supplement we have. There are others that are great, but if I could only have one, it'd be oil of oregano. The next is olive leaf extract. It's outstanding. You're constipated, Jeff. Noni juice will get you regular. Glucoman and fiber will help get you regular. This combination will get you moving. We don't want things to stay in the gut for 4 or 5 days. and this is the typical pattern. We want 24 to 48 hours transit time max. Noni Juice Foundations for Healing. You have any questions before we have to go to the break? Any questions? We have just 40 seconds.
Yeah, I actually, this has gotten to be so bad. I'm in the healing process now, but I think this got so bad it actually pulled like all my upper back muscles.
Yes.
And actually, it felt like...
Okay, thank you for reminding me. You need a high-quality multiple vitamin, magnesium, B12, and vitamin D. Your immune system is so suppressed, and the medicinal mushrooms to really... Now we're on the right track. I feel it, buddy. I feel it. We're going to get you well. Stay with this program. Let us know if you're not getting better. Folks, we have a break. We'll return for your call in just a minute. CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net.
I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Hello, I'm Dr. Richard Becker.
And I'm Cindy Becker.
As a physician and cancer survivor, it is clear to me that standard medical therapies are not enough. We need more.
That's why we created our television program, to give you natural health solutions that really can improve your life.
And now we're offering another way to learn about your health by subscribing to our new monthly newsletter.
Every month you'll receive critical information about preventing disease, your diet, healthy recipes, holistic therapies, and alternatives to prescription pills. Each edition addresses personal issues that may keep you from getting well.
Each month I share with you the latest research found in scientific journals about diabetes, arthritis, heart disease, and other common problems.
With your new 12-month subscription, you'll get 3 additional months free. Become a subscriber today by calling
888-442-1828 or order online at bioinnovations.net for the best prices of the year.
We're back, everyone, taking your calls the entire hour today. Today's show is all about you. We appreciate you so much, and we're so blessed to be able to come here every day and spend the hour with you and help you with your troubles and try to help restore your health. It's just great. Be sure you pick up the phone. If you haven't gotten in today, dial 800-635-2673 and keep trying. Well, let's go to Indiana now and welcome Linda. Hi, Linda.
Hi, Cindy.
Hello, Linda. How are you today?
Hi, Dr. Becker. I'm well. I've got multiple problems that
Okay.
hopefully you can help me with.
We will try.
I've got osteoporosis and also osteoarthritis and fibromyalgia and COPD and asthma and pseudo gout in my hands. And I'm just hurting all the time.
My goodness, I guess so. Linda, do you have an idea of the root cause of all this?
No, I don't.
How long have you suffered with all these problems?
For years now.
Are you a smoker?
No.
Were you ever a smoker?
No. My husband was a smoker, and he's passed away now. But I got it from secondhand smoke.
Do you think that's the cause of the emphysema? Because, you know, some people will get emphysema and never be around smoke at all. It's possible, it happens. But most are smokers or exposed to secondary smoke like you have been.
Right.
What are you doing besides taking medicines? You know, I'm sure you're taking medicines because you have a list of some very painful and challenging health problems. What else are you doing to help yourself?
Well, I'm trying to keep busy best I can, but I have problems because I'm also legally blind from retinitis pigmentosus.
Uh-huh.
And I've had that all my life.
Right. How do you get around? Who helps you?
I live by myself, and I've lived in this house for 50 years, so I'm familiar. And my grandkids come over all the time, and my great-grandkids.
So they help you with shopping and groceries and this sort of thing?
Yes.
Okay,
yes,
all right.
I'm unable to do that.
You have family, and that's so important. We have to have connections to get well and to do better. It's very important.
Oh, yeah, I have a real loving family.
So are you taking any vitamins? How about vitamin D? Are you doing anything?
I'm doing a multiple vitamin, and I've added about 2 of the vitamin Ds.
Okay.
3.
Does your doctor help you with your supplements, or is he the kind of doctor or she that really doesn't care about supplements? Where are you with that?
Well, I'm just doing them myself. They don't...
Understood. Okay. Well, girl, this is quite a list. Emphysema, osteoporosis, osteoarthritis, fibromyalgia, asthma, COPD. Well, a couple things come to mind. Number one, most important of all, is vitamin D. 2,000 international units is not enough. Linda, would you please tell me your size, your body weight, then I can tell you a good dose for you.
I weigh 150.
Okay. That's about 4,000 units every day, plus what you get in a multiple vitamin. A good multiple has about 1,000. Most do not, have about 400. So I want to send you more vitamin D, so your total vitamin D dose can be about 5,000 international units a day. And I want to send you a good multiple vitamin and mineral, because you're probably using a multiple vitamin from, say, the pharmacy or the grocery store, correct?
Yeah, from the pharmacy.
Now, I don't want to disparage any products, but I don't know what's in those products, but I know what's in mine. We made ours for sick people. That stuff you get at the pharmacies, that's not for sick people. You need quality stuff. You need a multiple vitamin that you absorb, that gives you... See, the way the human body works, we can get rid of extra vitamins really easy, but we struggle when we're low. And 80% of all Americans are low in at least one nutrient. And if you are sick, you are low in multiple nutrients, and you're sick. So you need a quality multiple vitamin. I want to give you the Active Adult Multiple Vitamin and Mineral, vitamin D. Another thing that comes to mind, fish oil, the omega-3s. Every single one of your complaints is associated with low omega-3 intake. Let me ask you, Linda, you don't like fish? Do you ever eat fish?
I eat fish at least once a week.
What kind of fish?
I really don't know. It's the fish squares, and I don't shop.
I know what you're talking about. That kind of fish is extremely low in omega-3s. Right. It's roughly equivalent to a hamburger in omega-3s. I'm sorry, but that's the truth. So I want to give you some fish oil. You should take at least 2 grams a day. I would take a little more, but 2 is the minimum. Next, digestive enzymes. Digestive enzymes, we cannot separate our intestinal function from the rest of the body. It's essential. And I don't know why I'm thinking this, but I get this feeling that you are not digesting properly. And these complex food particles are gaining access into your bloodstream, and it's greatly complicating your situation. So these food enzymes, digestive enzymes, they're not going to hurt you, and you might find that it takes an edge off the pain. And in some cases, it's remarkable the difference. Remarkable the difference. So a little digestive enzyme with each meal. Probiotics, probiotics, probiotics. Yogurt at every meal, cottage cheese, buttermilk. Take the dietary supplement too. You're not allergic to bees, are you, dear?
No.
Okay, royal jelly and Cordyceps sinensis. Royal jelly from the bee and Cordyceps sinensis, the medicinal mushroom. Helps heart-lung function. Final thing that I think would, two things, magnesium, you need it. There's no doubt. The fibromyalgia is the big clue, magnesium. And then support the mitochondria. The energy flow, CoQ10, L-carnitine, D-ribose. You're already on the magnesium, but I want to send you a little alpha-lipoic acid. Linda, it's important that you start real slow. Baby doses, work them up to a full adult dose over 2 months. You may have a healing crisis where you feel bad for a while, and if you're not warned of that, you may abandon the one program that might actually help you because you feel bad for a while. You know, when you come down with the flu, you have a bad night, you sweat, 103 fever, but you get on those covers and you shake it off in the morning, you break it, and boy, you feel so much better. It can be like that. Probably without the fever, but it can make you feel better. I just want to warn you about that, and we avoid that problem by advancing slowly with our dietary supplements. Any further questions before we go to our break?
No, that's...
Okay, your care package is on its way. We have a break, we'll be back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Here is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
Bioinnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today.
We're back. Let's go to Texas and welcome James. Hi there, James.
Hello.
Hello, James. How are you today?
Oh, I'm suffering from swollen joints. I'm getting old, one thing, but one reason I was wanting to call in and talk.
Okay, tell us about which joints are swollen.
Basically, from my belt line up, from base of my skull, my neck, my collarbones, my shoulders, my elbows, my hands, my wrists, all my knuckles just swole up to where I couldn't even hardly move them.
James, are they red, inflamed?
No, sir. My skin is not red.
When you touch them, are they extremely tender?
No, sir. No, sir.
They're just swollen.
Yes, sir. And it's also in my ligaments and my muscles. My
How do you know that?
Burn.
How do you know that?
Well, because I feel it. They go to
Yeah,
hurt, and
but James, I asked you,
bicep.
if you touch them, they're not tender?
Not to the touch, but
Okay.
I deep rub them is what I'm saying. It's a deep rub because
I
they
understand.
ache deep.
And your knees and ankles and toes, they're fine, no trouble at all?
No, sir. No, I'm not hurting down there. Now, I injured myself years ago, and I do have some arthritis in my knee from football.
Yeah, but this isn't the problem.
No,
How about
sir.
your neck? Have you had an injury to your neck, a ruptured disc in your neck, something like that?
Nothing recent.
Oh.
I've been in some accidents and all that, but I mean, just up to this is just like turning the light on. I woke up one morning and I was severely swollen. Don't let me forget to mention hornets.
Mention what now?
Hornets, wasp-type hornets.
Yes, have you been stung?
I've been stung about the same time this stuff started coming on. Somewhere within that week, I was stung by.
James.
Now these things live in the ground. And
Oh yeah,
very mean.
they're nasty. We have them in Texas, and I see you live in Texas.
I'm right outside Beaumont.
Yes, boy, you've not been stung.
Yes,
You've
sir.
been stung by a hornet in the ground. Let me tell you, that hurts. I get
Well-
that. James, here's the most important question. Have you been to a doctor?
No, sir.
Oh, see,
Can't
that makes
afford
it hard.
I'm a Vietnam vet, and I'm on the VA, but they've gotten so high with co-pays and the medicines. I'm just.
James,
well, I'm doing,
James, what do
listening
you?
to someone to help me with this.
James, I'm going to try. I'm trying. What do you think is wrong?
Well, I've got it narrowed down, and I've just started watching your shows, probably 5 of them, and I love them. Don't let me forget to tell you how fine your shows are.
Thank you very much.
And Cindy also. And your wife's name,
What do
Cindy?
you think the problem is, James?
Okay. My mother has
Rheumatoid arthritis,
my mother has
doesn't she?
diabetes, so
Yeah.
I went and checked my blood, and my blood is in the 80s and 90s. Last time I checked, it was 99. My blood pressure's a little low, so I thought maybe I had rheumatoid arthritis or maybe some reaction from these hormones.
James, that's what I'm thinking. Rheumatoid arthritis. But listen to me, James.
Yes, sir.
I really shouldn't try to diagnose you on television. Our callers present to me their diagnosis, and then I give them the alternative therapies. The great state of Texas thinks it's not a good idea to diagnose on television, and I have to respect that. And so, but I can help you. I can be one of the best friends you've ever had, and I want to help you. What keeps coming to my mind is the possibility of rheumatoid arthritis, and I have to help you understand, rheumatoid causes a wide variety of conditions. Rheumatoid spares the spine, but you can get it at the very top of your spine where your head does this. Is that where you turn from left to right in your neck, the very top part of the neck? Rheumatoid can attack that, but the entire rest of the spine is spared. It's the peripheral joints, and this is what you're talking about. Yes?
Oh, yes, sir.
Well, James, I strongly recommend you go to a doctor and get a proper diagnosis, because rheumatoid, if that's what you have, there's some 80 or more different autoimmune diseases, and about half of those have joint components. And so it could be any, but rheumatoid is one of the more common. If we catch rheumatoid early, it's imperative that we do that because it destroys joints. And it can cause the ulnar deviation that you see in long-standing rheumatoid arthritis. Everyone's seen that, right? We've seen that. That's rheumatoid. It's ulnar it destroys the joints. If we can get to it early, it's when it's most effective. Some general things that I would love to see you do that can be most helpful for you. Vitamin D. Take at least 5,000 units every day. People with low vitamin D levels are like 4 times more likely to get rheumatoid and autoimmune diseases. And if they continue to have a low vitamin D level, their progression is rapid and it's more destructive. So it's important we get that vitamin D up. Fish oil is very important. It calms the inflammation. Also, many people react to foods. I remember a patient who was diagnosed with rheumatoid arthritis, and she made the remarkable discovery, if she quit eating chocolate, her rheumatoid went away. No more joint pains. This told me early in my career that foods can cause disease. Foods don't always nourish us. Sometimes foods destroy us. And it's unique to the individual. And the literature is supporting what my early observations were. So think about foods. The nightshades, potato, tomato, help me with the nightshade, pepper, what else is in? There's
eggplant.
Eggplant, tomatoes, potatoes, eggplant, pepper. If you eliminate those, that's a good start. I also want to send you Foundations for Healing and the medicinal mushrooms because they help to regulate and control the immune system. What else can we do? Curcumin is helpful for this type of arthritis. Grapeseed extract, olive leaf, and noni juice for the pain. But please promise me, James, you'll get into a doctor for proper diagnosis, then we can help even more. Is that a deal, James?
Yes, sir. I've got to do something. Now, I have gotten a little better, but...
well, let's try these supplements. Let's try these supplements and get you started. But please get into... It's just a blood test, maybe an x-ray of the hands, a little examination over, and then the doctor can have a much better idea. Then we can help even better. We have a break. We'll be back for the wrap-up. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. How often do you go into the grocery store to buy just a bag of chips or candy bar? I suspect not very often. Then how is it that these foods make it into our grocery bags and pantries? Do you make impulse choices and buy junk food? To control that impulse, plan your next trip to the store. Write down at least 3 days of menus and build a grocery list with the ingredients needed to prepare the meals. Eat a healthy snack before going to the store. If you are hungry, you're less likely to stick to the grocery list. Shop the perimeter of the store, starting with fruits and vegetables. Have you ever noticed the most healthy foods are in the outer aisles? And avoid items displayed at the checkout counter, trying to entice you to make a last-minute purchase. Follow these tips and make a plan so your next trip gives you control and you come home with bags full of healthy food. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet,
and most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings.
Your health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Hasn't this hour just flown by? It has for me. We've had such a great time listening to all of your calls, taking your calls, and seeing what we can do to help all of you. And you know, as we look at these calls, I'm reminded it's really interesting the common thread of wholeness and holism that goes throughout all of them. Our plans really aren't that different, are they?
Right.
So, Richard, it was really neat. I was looking at the different answers that you gave to the calls today. And the first thing that I noticed that is in everyone's plan is D3.
Absolutely.
Isn't that amazing?
You noticed that too. I was just adding that up myself.
D3. We all need D3.
We all need D3 and much more than we have thought for a very long time. Don't be afraid of this stuff. We really should call it hormone D. It's our immune system hormone. It's our bone hormone. It prevents diabetes in people. It prevents heart disease. It's the coordinator. Every cell in the human body has a vitamin D receptor on it. So that tells you that it influences all cells. It's that important. And the studies show the vast majority of Americans are tragically low. And you know what's unfortunate, folks? Some people want to discredit vitamin D. They don't want you to know the truth about God's nutrition. And it's really sad because foods, nutrients, essential vitamins and minerals, amino acids and proteins and essential fatty acids do what no drug can do. What we're doing in America is treating nutrient deficiency symptoms with drugs. And you become a perpetual patient on multiple medicines, and you're not going to get well that way. Medicines have their place. I'm not saying to ignore them and never use them, but we got to support the nutrition aspect first. The next theme through all the callers, whether it's breast cancer, leaky gut, emerging arthritis, emphysema, and chronic pain, is intestinal dysbiosis, chronic yeast. We're exposed to toxins. Our immune system is overwhelmed. Our bowel flora is altered. We're around heavy metals and pollutants. Our mitochondria become so weak we can't fuel the healing process. Support these systems. That's how we create modern-day miracles. It's amazing to see, and I am so happy to be a part of this with you in your life. It's a privilege. Thank you for having us in your homes. We will see you again tomorrow right here on Your Health. Goodbye, everybody. Good to see you.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-935-4051. If your employer doesn't supply health care coverage and you don't qualify for Medicare or Medicaid, you need to give us a call right now. Private health care is private health insurance for ages 65 and under with no deductible. To get the coverage you need, call the number on the screen now.
Attention timeshare owners. We're offering you a way to legally get rid of your timeshare. So call right now to qualify and receive a free consultation. You can terminate your timeshare legally and permanently. Call the number on your screen today.
Introducing Paisano, the authentic pizza oven by Granite Stone. Now make the world's most delicious pizza with real stone right in your own home. You simply set it and let it make golden, crispy, extra cheesy stone-baked pies in under